See these phones, these nondescript smartphones? Well, these phones are special. These two phones are going to help the Australian Cervical Cancer Foundation save women's lives. They will ensure women are healthy and strong so that they can continue being a mother, a wife, a sister, a small business owner, and an important member of their community and economy. Well, we all know mobile phones are handy. They connect us, entertain us, they educate us, and they allow us to contribute to causes we are passionate about. But these two mobile phones in particular are going to save lives, lots of lives, and impact many more. Let's get Erin to explain.
Out of approximately 280,000 women who live in the Solomon Islands, only 1 to 2% of them have ever had a Pap smear. This may not sound like such a big deal until you consider the fact that Pap smears are the #1 way of detecting cervical cancer. It gets even worse when we look at the cold hard fact that cervical cancer takes more women's lives in the Solomon Islands than any other cancer. Unfortunately, I'm not here with a good news story, at least not yet anyway. The World Health Organization estimates that cervical cancer in the Solomon Islands will actually double within 20 years. Why? Well, the Solomon Islands don't have an organised screening program. If you're lucky, you can get a Pap smear at the National Referral Hospital or in one of the other 3 places in the entire country. I know, it's shocking, but together we can change this. Here at ACCF, we've just finished the launch of the HPV vaccination program in the Solomon Islands. It's a huge step forward in preventing cervical cancer, but now we're looking even further forward. We're looking to implement the country's first cervical screening and treatment program. Don't worry, this isn't our first rodeo. We know how big of a job that is, but we've done this before. We've implemented sustainable HPV vaccination and cervical screening and treatment programs in developing countries before. In Nepal, where ACCF all started, we vaccinated over 31,000 girls since 2007. In between all those needles, we've also constructed a women's clinic in the town of Banapa, which is a base for our mobile vaccination and screening camps, as well as training facilities for local nurses and vaccinators. And in Bhutan, ACCF launched the first national HPV vaccination program in a developing country. And since that launch in 2009, we've facilitated the vaccination of almost 70,000 Bhutanese girls. When we look at implementing a program in a developing country, we don't only look at providing access to health services, but into education and awareness for local women as well. Just like we do with our work here in Australia, we focus on educating women about the importance of screening and of receiving treatment. With education and access, we can empower women to take control of their health. And if they do require treatment, we ensure that they understand that by looking after themselves, they can be here into the future, contributing to their families, their communities, and their country. I'm not going to lie, all successful programs have their challenges, but this time we're taking a different approach to our screening program in the Solomon Islands. We're using innovative mobile technology to help us save the lives of more women and facilitate recording of data and records to contribute to a more accurate screening coverage. Mobile Pap Scope technology gives us an exciting opportunity to screen the women of the Solomon Islands. The women that this little device will reach are those women who live in remote communities where access to health services, especially for women, is largely restricted due to the lack of medical resources, cost, and lack of portable medical equipment. This little device has the ability to change all of that. By using the mobile phone's camera and the microscope attached to the device, a trained nurse or doctor can take a visual image of the cervix and diagnose any abnormalities or precancerous lesions instantly. This information is then stored in a cloud-based facility for accurate record keeping and follow-up. This little tool that is no more complex than a mobile phone and a device that you can carry on your neck can change the face of health screening in developing countries for women.
With the help of Project Inspire, ACCF can ensure these two phones can make the journey to the Solomon Islands and start saving lives and, importantly, ensure the health, happiness and empowerment of the women in this country and many other countries like it.